everyone. Thanks so much for joining us. Lovely to have you here with us. I'm Dr. Margo Jacquot. I am your mental health business mentor. So glad to have you here. And you can see I'm pulling my mic toward me. So glad, I know, right? So glad to have our guest today. Today I have Stacy Schaffer. She is a licensed professional counselor with over 20 years of experience helping children's, teens, and young adults navigate emotional and behavioral challenges. Based in Arvada, see, I'm going to do the live demo. Based in Arvada, Colorado, she's the founder and director of Stacy Schaffer Counseling and specializes in both grief and, see, I'm going to do several live demos, specializes in both grief and anxiety therapy. Her extensive training includes a master's degree in professional counseling from Ottawa University, a graduate diploma in Christian counseling from Phoenix Seminary, and certification in EMDR, eye movement desensitization and reprocessing. She's a proud member of both the National Association of Play Therapy and the Colorado Association for Play Therapy as well. Stacy Schaffer, thank you so much for being here today.
Yes, thank you for having me. I'm excited for this conversation.
Well, I am as well. So this podcast is designed for therapy practice owners. Maybe they're individual practices, maybe they are group practices, but trying to give people insight into what works in the realm of business. So today we're going to talk about giving services, offering services to youth. So let's start there. So in your experience, what are some of the unique challenges that kids and adolescents are facing right now that help make sense for a practice to add youth services?
Yeah. Well, I'm so glad you asked. So I recently wrote a book that came out in April, and it's called
Congratulations.
Thank you. It's called With Love. So I'm a children's therapist, #lessons I've learned along the way. But so much of the content is about counseling the youth of today and how that is so significantly different. Because I think a lot of times, adults will say to kids, I was a kid once, and which is true because, that's how development works. But they were not a kid in this generation dealing with the social media challenges, like some of the accessibility of the internet, the school violence issue. There's so many things that are different. And so I think that it's really important to know the context of which kids are living in today. And because it's not the same world. It's not. There are threads of similarity, but it's a different world.
Well, it sounds like in my understanding, even a different world now than it was 10 years ago, 20 years ago. Like it's changed dramatically. Somebody was telling me recently that there was a school violence incident, and it was the kids who were guiding the adults to know what to do because the adults had no idea. They hadn't had all of this training on what do you do in case of violence in your school. So there are a lot of things that are different about now.
Sure.
So were you always a child and adult? Do you see children and adolescents, by the way?
Yeah, I see kids,
Okay.
teens, and young adults. Like I say that my range is like ages 3 to 30. Sometimes I've had a young adult stay on. So as I age, they age. I guess that's how that works.
Yeah, right. Unfortunately.
Yeah. I would say that the meat of my practice, like the tweens and the teens, there's outliers too.
Okay. So, right. So you see, what is your youngest that you'll serve?
Like in this moment, I see a 4-year-old, but I have seen a 3-year-old. And so that had nature trauma kind of thing happen. And so in response to that, like was not even that verbal, but we did a lot of play therapy. And so got to see the kid move through that. But yeah, I mean, I think that what is changing in the world, lots of things, is that we have really worked on removing the stigma of mental health for our youth. I think that it's saving lives. The kids I see currently, they don't really understand when I talk about an intake. When I say, hey, if you see me in public, you can say hi to me. I can't say hi to you. And like across the board, at least in the last decade, kids are like, but like, why why wouldn't I just say hi? And I'm like, well, you can, but you might be with a friend and they might be like, who is that? And why does she wear so much purple? And these are questions you can't answer because I don't know. And the kids always like almost like with 100% accuracy say, why wouldn't I just say you're my therapist? I'm like, well, you can. They don't want you to be afraid to say those kind of things. But I hear kids talk with each other all the time about, yeah, my therapist said this, my therapist said this. And I feel like that is one of the shifts that's beautiful in the world.
It is such a beautiful shift. You're not kidding. And folks, if you're listening to this and you can't see Stacy, she has on a beautiful purple top and her office is decorated in purple. Her mug is purple. So you would be wearing purple clothing. That's really wonderful. Yeah. So clearly the stigma has changed. And what we've discovered in our practice, and I'm assuming as a child and adolescent and young adult therapist, you're seeing this as well. The need for services, the request for services has exploded. We just added 9 new offices and everybody office shares. We have so many kids coming into our practice, kids and teens into our practice since the beginning of the pandemic, which I think is true for a lot of folks. Something shifted significantly. So I'm assuming that's happening for you as well. So you're talking about play therapy. You are a member of a couple of play therapy associations. Will you please speak to play therapy? What is it? How is it different than traditional therapy? And I'm asking like a compound question here. I'll go back to it. But, there are therapists who believe they're doing play therapy if they have a checkers game out, or if they have, a couple of cars that they can roll around on a coffee table while they're talking to the child. Like, we'll play while we're talking. That's not exactly play therapy. So would you please tell folks,
Yeah.
what is play therapy? How does one get trained in play therapy and why?
Sure. No, those are really good questions. And yeah, I would say that there has been a marked like increase since COVID. And me personally, we live not too far from where the last school shooting was in Evergreen. And so I see people in the Evergreen community because it's a mountain town. And so a
Yeah.
lot of people come down. And so whenever something like that happens, the like reverberation is a lot. And so I'm glad people are getting support, but there's not enough of us. So play therapy, one of my favorite modalities is sand tray therapy. And so I'll explain it for your listeners that might not know, but I have in my other office. It looks like a coffee table. My friend David made it for me, and it's gutted and filled with a special kind of sand. And then to the side, it looks like every Happy Meal over time exploded and ended in character groups. Like they're all just lined up. They're just hanging out. And so the cool thing about sand tray is all of those things get to go into the sand. And so one of the directives is find me a character to represent you and show me what it's like to be you. Like I'll like split the sand in half, be like, show me you at home, show me you at school. And one of my favorite examples of sand tray, I had a high conflict divorce and the child picked a really tiny mouse as mom and Darth Vader as dad. And like was showing the character of them like in between, like trying to vacillate. And that tells you so much, right? And so sand tray is like, okay, like the character to represent them. Then I'm like, show me what that character wishes would happen,
Mm.
and then the mouse and Darth Vader are holding hands. And so there's so much beauty to being able to communicate because the language of kids is play. Like that child didn't have the ability to be like, I'm feeling ambivalent about the choices that they are making. You're like, well, this is your experience. You're still experiencing it, and it needs to be vented in a way that is at their level. And so sand tray is one of the things because a lot of children's therapy is really symbolic. And so you're picking up the themes of what the kid is trying to communicate.
So having a well-stocked play therapy room seems really mission critical. So folks are considering having therapy for youth. hopefully they will consider play therapy. Folks, I'm going to just tell you this is my clear and present bias just because of the data on how children work and developmentally, what good child therapy is like. And there may be people who are doing other things. I welcome your suggestions as well. Art therapy, all kinds of things. But what sorts of things would a practice need to make sure they had in order to be a well-stocked play therapy,
Yeah.
have a well-stocked play therapy room?
Yeah, and I think there's like a lot of things you can buy, but I also want to say like a mentor of mine in the field, Lisa Dion, her quotable line is that you as the therapist are the most important toy in the room, and that it is about relationship, relationship, relationship. And so I've seen therapists like run themselves ragged at conferences trying to buy the newest thing when you need to make sure that like you're equipped as a clinician. And so I think to start there, right? Because when I first started 2 decades ago, I had my sand tray table and had a couple games. I was like seeing these kids that had this like major trauma, and I was still able to find a way to reach them. With that said, I do like buying stuff. It's important to me to stay current on the latest trends, which is a little painful sometimes because the K-pop demon hunter thing that they're all into,
Oh, no.
I can't. Like a kid will ask me who my favorite character is, and I'm like, that's why I went to grad school. Yeah.
Right. Yeah. To find the K-pop demon hunter.
Oh
Right.
my gosh. Yeah.
Oh,
And so, because I think that it's really important to speak to their context, because a kid will say to me, I feel like, this character, one of the lead characters, which you're going to see every Halloween costume with girls as K-pop demon hunters. Mark my
okay.
words.
Okay.
And he'll be like, oh my gosh, she's so smart. And I'll be like, yeah.
Stacy said.
Yeah. But it's really important to me to know like the choices that they're making, say, like even if in like sand, it's like it's important to know what that character means to them, right? Because there was one of the characters in that show that has this dark backstory that like you never find out, but there's going to be it in second, but yeah, you never find out. And so if I have a client choosing that, that tells me a little something. It doesn't tell me everything. And it's not fair to 100% assume, but it's a launching point for conversation. They're like, Mira had stuff going on. Like, I wonder what you think she was trying to hide. And like those kind of things. So I'm pretty well versed in the latest trends and like the 6-7 thing. I don't know if you know about that.
I don't.
Well, it's like not even noteworthy. It's just like they say 6-7 over and over and over and over. And so, yeah, again, grad school.
Right.
And so,
Right.
yeah. And so I think that like everything that I choose in my office is really intentional with them in mind. They're like, you are speaking like to me, not at me, that we're like on that same page.
I love that. You're speaking to me, not at me.
Yeah.
So to your point, we don't have, when I say you need, a well-equipped room, that doesn't mean that we have 100 toys from which to choose. That can be a lot.
For sure.
Right. Who is your population? Do you see mostly boys, girls, people who are not very gendered? Are you in a community where kids can be more gender fluid? Is that so? Right. How do you represent that for kids? But it sounds like some characters are really good to have. Maybe
Sure.
dolls, maybe dollhouse sized toys, maybe sand tray sized toys, puppets, something like that. Maybe a house,
Yeah.
something so that people can kind of do that representational play. But to your point, you started with a sand tray and a couple of games,
Yeah.
and you were well equipped, so you did just fine.
Yeah. And so, but like, yay for stuff. Like, I also have a therapy dog in training. I have a golden retriever. I can bring her on set if you would
Okay.
like to see her. She is equal opportunity. She just turned a year. So she's a highlight around here. But I also have excessive amount of slime. Like, there's a company that I feel like I'm feeding their families, which is nice of me.
Great sense of humor, Stacy, which probably goes really far. with
And
kids. That's great.
I'm humble and amazing, which is a hard combo, you know?
Right.
Like,
Yeah.
and so the amount of slime that I have in my office, like every age group likes that. And so they'll
Mhm.
sit and talk with me and play with the slime. I have a million different kinds of fidgets, and like
Mhm.
the research shows that doesn't mean you're not paying attention, like it's helping them regulate. Because I used to just have one office before COVID. I shared with a husband and wife that are therapists. We all went home and then they discovered they like home. I came back pretty quickly because I felt like my clients were suffering. Yeah, I came back when the tattoo parlors opened up. Yeah. I was like, the tattoo
Yeah, that's a good indicator.
I'm like, your kid's therapist should be able to show up. And so then I turned this room, which was their room, into like more of a chill vibe. So like the teenagers I have later today are going to pick this room.
Mhm.
But my rooms are sunshine and twilight. And so from the very beginning, when like kids walk in, like for their session, they get to choose what room. Like, I don't care.
Mm.
I'm like, they're both mine. And Willow, my therapy dog, like knows the difference. The rooms, it's the cutest thing I've ever seen. So I'm like, go to sunshine. And so there's agency there because
Mhm.
I'm really big into like non-directive, like that it's like I
Mhm.
have all these things to choose from. You get jurisdiction over what we do. So
Mhm.
that's
Mm.
really important to me.
Which I think the literature 100% supports that with kids, that the more agency they can have, and sometimes, if you have the luxury of having extra space, great. What great idea. Or maybe having a room, if we have one office, to have different zones within the room.
Yeah.
If you don't have the luxury of having extra space so that there's agency around that. I love that. It sounds very cool. I would love to see this next time I'm in the Denver area.
Okay.
So,
I'll be here. I'll be
right.
vulnerable.
So when if a business owner, a practice owner is considering adding child and adolescent therapy in particular, and probably even more so kid therapy, I think a lot of people see teens and that we don't need to necessarily have as many things, but it might be really good to know a bit about what's happening in their culture. And I mean,
Yes.
the popular culture of their area, of their age group, to know that is really critical. Why does it make sense for people to add youth services if they haven't been doing it historically?
Yeah. I mean, now's a good time because the kids are not all right. They're not all right.
The kids are not all right.
No. And like one of my like pillars and my soapbox like issues is that why do we say all the time that kids are resilient, but then what are the adults in therapy talking about? Their childhood. And
Yep.
so there's got to be like some skills along there, like instead of just using the cop out, that like the kids will be fine. I mean, first of all, what choice do they have? Like they're like, can we carry on? But it doesn't mean it's like without damage. And
Mhm.
so I always say I like to help prevent less hurting adults because life is already hard, right? You've been outside, it's hard. Why do we not have services to make it less hard in a way that we didn't have? And so I always say to parents in intake, I'm like, can you imagine like having someone to talk to when you were 10? And they're like, it would have made things a lot easier. Because I always like counseling to be framed as a gift as opposed to there's something wrong with you.
Yes.
So they're like, this is where we are offering this. And the beauty is that kids like they're embracing that, that they're
Mhm.
just like, yeah, like I go talk to someone in my life is hard, you know.
Mhm.
And
Mhm.
so I think that it is so much preventative healthcare, so much
Mhm.
preventative healthcare in ways that we probably don't have measures for just yet.
Mhm. You know what? I think that's very well said, right? It is preventative. I've worked in addictions throughout the course of my career and trauma. I mean, we know the parts of the brain that govern addictions, they all sit in the same place, emergency response centers and addiction centers. But the thing about, why did I bring that up? Boy, I can tell I did not sleep as well as I needed to last
It
night.
happens here.
What were you saying right before
Well, you
that?
were preventative healthcare.
Yes. So what I remember being at a conference, and one of the presenters really is a pioneering researcher in addiction, and he calls addiction a pediatric disorder.
Oh, I got
Not
goosebumps.
right. I thought that was great, not because kids are using drugs and alcohol, but because the stage is set. The brain and the development with trauma, with stress, with anxiety that's left untreated, it evolves in adulthood. People do need coping strategies, and boy, drugs and alcohol work really well. So, to
Yes.
your point, it is an incredible gift to kids. It's preventative medicine. I love thinking of it that way. So, I mentioned a little earlier that we just added on 9 rooms, which means a lot of people are bringing their children. And often people will bring their children before they'll bring themselves, right? They'll
Oh, for
do for
sure.
their children right before they'll do for themselves. So, just from a business perspective, do you find it easy to bill insurance? Do you take insurance?
Mhm. I do take insurance. I do not love insurance because America, but I feel like there's inequity in healthcare. And
Mhm.
so I
Yep.
take Medicaid, I take all the major like insurances. There's a billing company that I use for most of them. They do the fun stuff. But I probably, I mean, things could change, but I probably will never stop taking insurance because most people that I see need to, like, need to use that.
Mhm.
I'm a part of a couple of local organizations that are teen suicide prevention that like one is called Second Wind Fund. And so their mission is to end youth suicide. And so if there's a kid that's presenting suicidal but is underinsured or uninsured, they pay for it. And so,
Mm.
like at a discounted rate with providers, I do see Second Wind Fund kids. And so, yeah, the admin of it all, it used to be so much until I hired the company that most people around here use, like Headway. And I think that I got audited last week and had to do a thing and then it was fine. There's those irritating moments, but like if I like look about how long it's been since I was like last had to deal with anything on my end, like it's worth. So
And arguably, this is something our therapists are up against too. If you're seeing an adult, you schedule them from, 3 o'clock to 3:53. You have your 7 minutes to go to the bathroom. Maybe you might need to connect with another therapist if they have a couples therapist, or maybe there's a physician if they have a medical issue. These are more rare. With kids, there's communication with parents, there's communication with schools. There might be attendance at IEP meetings. There's a lot that goes into seeing kids, in addition to your usual documentation and everything else one needs to do. So, and a lot of that isn't covered by insurance. So, how do you navigate that?
yeah, I think I don't focus too much on it because it would probably make me crazy. And so then I'm just like, it all like shakes out in the wash, that it eventually, like I'm successful enough that I don't think of the nitty gritty. And maybe I should. But I think in the beginning, when I was building a practice, that it was like, okay, well, like this many on this insurance, this many, but like I think once you're in some kind of groove, I've been doing this for a while, that like it's not really a conscious thought. I do my own billing for a couple of insurances. And every now and again, I'm like, oh yeah, I have to go do that. But then I make myself stop and look at each one of the HICFA forms. And I'm like, this is an
Mhm.
actual person that I'm showing up for. And they would be like less solid if they didn't have a clinician in their life. And so I'm doing this for you. I'm doing this for you.
Yep.
That
Yep.
it becomes less of a paperwork thing and more of like it brings the person back to the front of my mind.
I love that way of thinking about it. I wish it were different. I wish the add-on codes still existed in the same way and that people could get paid. People used to be able to
Mm.
get paid
Yeah.
by insurance. Now, and this can be tricky, but In the informed consent and in the initial paperwork, different clinicians in our practice approach this differently. Some do it exactly like you're describing. They're saying, look, this is just a part of the job. Others will say, okay, so we'll save a certain amount of time in a session to make sure I can answer parents' questions. But anything beyond that, parents, I'm going to charge you a fee to read and communicate or to have long phone calls or whatever. So some of it might be the responsibility of the parents, but boy, they would need to have, the clinician needs to have that conversation on the front end. And
Yeah.
if you're not comfortable talking about money, then don't do it. Then just assume it's part of the job. Or if you work with a population that's a Medicaid population who doesn't necessarily have extra money, then you're doing it for the love of the kids that you're working, for the love of the work. And some of that is just always going to be the case. If you're working with a population where parents can afford to pay for you to attend an IEP meeting or to have regular contact with them based on the law and the appropriate releases, then fine. But it's a little more complex in that way in terms of money. And I think conversations with parents, it's even more important so that they understand on the front end. But I love that you have your heart in the place that you do and you think, okay, this is for this child. That's why I'm doing this. That's great. Do you find that you are able to see 20, 25 kids in a week more? Would you say a caseload is a little bit different working with children than it would be working with adults?
I don't know what it would be like working with adults. So, solidly because of my entire practice, I've seen kids, teens, young adults. But I mean, I don't know. I think it's energizing to me, like to have some of the conversations that I do, especially like when they're tweens, because they start saying funny things along with profound things. But I think like showing up like embodied makes like the energy like equivalent no matter who I'm seeing. And
Mm.
so if I'm meeting with parents, because like I'll respond to emails, but if it's an involved thing, I'll be like, let's schedule some time. And so I think it's like congruent with what's going on inside and what like comes out. I think it
Mm.
makes the energy like come out a lot easier.
Mhm.
And so I try to be better than I was like when I was a new clinician about overbooking
Mm.
because I was like, I can save the world. And now I'm like, I
Right.
can save no one. So
Right. It,
cool.
we are all humble there.
Yeah.
Right.
And I'm like, oh, I'm just okay, just scared. And so I think that it's really important to me to actually practice the self-care that,
Mhm.
they warn us about, but it's more than just taking a bubble bath. I think it's caseload. And so I had a waiting list for a bit because I cannot add to my capacity because it's not fair to my current caseload. Everybody wants the after school spots, like
Mhm.
3, 4, 5. And I kickbox every night. I punch back so I don't punch people.
Good. Okay.
Yeah,
Yay.
you're all welcome. And so it's important to me to attend my 7:15 class. And so I can only like the math of it all. I like feelings, not math, but the math of it all, I can only do so much. So I don't take on new ones that are like, we need 4 o'clock on a Wednesday. I'm like, well, mm,
That you don't
yeah.
have it. Right. I mean, and that's the thing. And I say this to folks now because during the pandemic, lots of folks were working virtually. And we do have people who send us resumes and say, I would like to work for you, but I want to work with kids and I want to do it all virtually. We don't hire those folks. I haven't seen that work. I think kids, I do have some biases here. I don't about a lot of things. This I do. I think in person for kids is great. Once you get into tween years or teen years, they're more accustomed to being on a screen and relating to people on a screen. So it sounds like you see people in person. So that's just something to consider. It's hard to do play therapy on a screen.
Yeah, I do still see some kids virtually. I'm actually licensed in Colorado, obviously, but I'm also licensed in Texas because I had a family move there and they paid for that to happen. And
Nice.
so there are things that we can do. Like if they're like above 8 or 9, There's flex because when COVID happened, everybody moved to
Really.
online. And that, I would play this game with kids, room scavenger hunt. And so I'd be like,
Mm,
okay, go find something that someone you miss gave to you. And so
mm,
they should be things. So there's workarounds, but
mhm,
it's not ideal.
mhm,
And so I still do see some virtual, and if they're like sick or scheduling, it's convenient, but you just have to be a little bit more creative. But I was watching kids suffer because everything was on the screen.
mhm.
I had a kid that was into competitive swimming, and the mom said it would be the same just to swim in the bathtub. And it was not the same. And so I'm like,
Clever.
there are workarounds, but if we don't have to, I don't want to.
Right, right. Okay, right. That's fair. So with certain age groups, it's
Mhm.
perfectly fine. With certain
Yeah.
kids, it's perfectly fine. And the therapist just needs to be prepared to
Yeah.
be pretty agile, to be able to pivot quickly, to be creative. That
Yeah.
makes sense. Again, now that kids are all back in school, really, this is an afternoon and evening and potentially weekend endeavor. So having space available for a therapist, if you're a practice owner, during those hours would be really important. And as a child and adolescent therapist, sort of expecting that would be wise as well. So, Stacy, what are the top three things in summary you would like our listeners to know about adding play therapy to your repertoire of services?
I would like people to remember that what they have the opportunity to do is to help kids develop a core positive memory of therapy because they're going to need it when they're older too, right? Because,
Right.
yeah, out there.
This
And
life is
so,
hard.
yeah, ladies are, and so that there's an opportunity to start that positive
Mhm,
association with
mhm,
therapy when they're young. They might not remember everything, and unlikely they will, but when they are 30 and having some challenges, they're not going to think that counseling is like something important or that is not for them. Like, no, that's where I went when I needed support.
mhm.
So I would say like help building those core memories for kids because then they could be your future clients too.
That's
Um,
right.
am I right? I would say that also if you are wanting to be like relevant to the kids that you see, it's probably a good idea to know one thing that this child is really into at the very least. I used to know so many kids are into Minecraft. So I have these like Minecraft magnetic blocks. And to have like those out, like it makes a beeline. So you don't have to know ins and outs. You don't have to know about like K-pop demon hunters, but know something. You know
Mhm.
something. And not just in a generic way. Like kids like candy, right? Not like that.
Right.
Just like something. And I would say that part of my heartbeat and part of my book is about therapists, in my opinion, need to be doing their own therapy at some point in their journey. Not all
Mhm,
the time. I mean, I do because like life is hard. And like, we love us some Melissa. But I
mhm.
think that it is crucial in being able to model to the younger generations that you're always doing your work.
I love that. Those are great. And tell us again the name of your book, folks. We'll have Stacy's information, her website, everything in the show notes. But tell us again about your book, please.
Okay, I'm putting it to the screen. If you cannot see
Mhm,
listeners, it's called With Love from a Children's Therapist, hashtag lessons I've learned along the way.
mhm,
And so I've been saying it is parts wisdom gathered from my less than ideal childhood, like funneled out, in addition to what I've seen on my side of the couch for the last 20 years, and like kind of channeled together as like an inner child healing journey. My hope is that people feel seen and understood in within the pages. And pretty proud. There's a lot of funny stories too, but there's a lot in there that I wanted people who might like not ever get the chance to bring their child to counseling, that they still had access to some of the insights that I'm like just seeing in my day to day.
I love that. Well, congratulations
Thank
on
you.
the book. It's a beautiful book, folks. If you couldn't see the cover, it's really beautiful with a purple cover. It's quite lovely. Well, Stacy Schaffer, thank you so much for joining us and sharing your
Yeah.
wisdom. You have a great sense of humor. You're delightful, folks. Check out Stacy, check out her book, check out her website. We'll have all that in the show notes for you. So thank you so much. Thank
Yes.
you, everyone, for joining us. Lovely to have you here as always. Please join us again next time. Be
Thank
well.